Hey everyone, hope you're doing well. Wow, this video it just really just cringes me. It's about the what I deem as an evil nurse, and I'm being kind. She a white female nurse here who's a black woman in labor. They consider active labor. She's just sitting there all casual as a lady is in labor. I mean, it's like, I don't know if that child might be crowning. They said she gave birth 12 minutes later. And this is at the caption says Dallas Regional Medical Hospital, Mesquite, Texas. So we have this black lady here, bless her heart, basically about to give birth in a chair while the nurse just sit there all casual. Questions. The baby was born 12 minutes later, and there was an issue. Let me go ahead and play this clip. Kind of triggering, it has to be a painful moment. It's nothing like calling an epidural if is there enough time to get that shot in her back to leave it the pain. But oh no, bad Bill. What is this lady name? The nurse is called. They said her name is LaChrista Vaughn. She just sitting there all casual as this woman is about to give birth in a chair. Unbelievable. Oh my God.
What? How many times have you been pregnant? 3. This is your 3rd pregnancy? Yes. You have 2 babies at home? My ass. You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
Mm.
Last name is Jones. She's G3B2. Not sure what her due date
Woman
is.
breathing hard.
Her due
I
date
just
is
said it was
10.
the 10th. Her due date is the 10th.
Now hold on. She's asking about the due date. You know what I think this is? Ain't no way in hell you're gonna tell me. So if someone is sitting up here having a heart attack or a gunshot wound, or in this case having a baby, you gotta ask these questions first. That's a whole bunch of BS. And yes, besides the labeling this as being medically negligent, I think this nurse is just evil and racist. Call it for what it is. Let's add that in too. You can even hear the woman like breathing hard, panting. What is your due date? You gotta be kidding me.
She got 3 pregnancies, 2 babies at home. I bet y'all listen next time.
Oh my gosh.
When you found out you was delivering at this hospital, your ass should have changed doctors.
Oh my God.
Everybody say how they treat people here.
And see, so when she said that, the one that's recording, she said everybody says how they treat people here. Think about it. What if we didn't have any phones to record it? I bet nobody would have believed it. And the fact, the hatred and the evilness of this nurse, this big bone, bad built, evil, cold hearted nurse to just sit there so calmly. Oh, it speaks volumes. Oh, it speaks volumes. It's a wonder she didn't get grabbed from the back. But you never give the enemy what they want. My thing is, how many times has this happened? And I think the one that's recording is her mother. How many times has this happened? This may not be the first. No, she's too casual with it. Now, I have seen some other reports that are suggesting that the nurse, LaChrista Vaughn, that she's been fired, and then some say she's lost her license. I'm not sure. I hope that is the case. sue the hospital. And ma'am, if I were you, I would check and see about an attorney, so I can't give legal advice. Must say this is for commentary and informational purposes only. See if you can sue her individually and personally. I would. Another video that showed the mother had uploaded is that the baby during this time had a bowel. I never heard of this before. Had a bowel, I guess, inside the mom. So it makes me wonder if that's causing a medical issue, it could have been avoided. There is no way you can let me think that this is the first time this woman has done this. There is no way. I won't believe it. Too casual with it. And the hatred is so strong. Besides risking her job and her license, I think she should all be charged criminally. She could be put this woman's health at risk, in my opinion. It seems so intentional. That screaming and that hollering. It says her son was born 12 minutes later. So basically, this lady was sitting in a chair giving labor. Giving labor in a chair, and the nurse just asking questions, calmly just sitting there. This is an evil, cold-hearted witch, in my opinion. Whatever happens to her, the worst is fine with me. But imagine, what if the camera wasn't there? And then you wonder why. Oh my goodness. You wonder why the mortality rate for Black women in this country at hospitals during childbirth. You wonder why the rate is so high. Because nurses and doctors like this were not believed. This is why. It's not by accident. You could be anybody. You could be Bucktooth Becky from the backwoods with no insurance. They're going to still look at the ratio. They're going to still make sure. Not that I'm saying anybody should be deprived, but they're going to still make sure that you get the best treatment to save your life. Black women searching for these doctors, honey, you got to do research. And you wonder why the mortality rate is so high. This is why. Ignored, not believed. They know what they're doing. Ain't no way in hell you're going to tell me, well, they know exactly what they're doing. This video sickens me. I'm going to, anyway, I'm going to keep it calm. I'm going to end this video. The horror, the inhumane treatment she received. Again, if the video wasn't there, I bet she wouldn't be believed. Her son was born 12 minutes later. And she just sitting there. I think what she was doing, she wanted that woman to feel that pain, being so racist and mean. I think she wanted her to feel that pain. So to ask these questions, that's just to cover up. Well, I had to ask these questions, girl. But again, it's a wonder. Oh my gosh. I thank God I'm not in a situation like that, because I don't think for my loved one, I'm not a violent person, of course not. But for my loved one, I just couldn't be in that calm recording. Somebody's going to have to record while I do something else. This woman should face criminal charges. Anything wrong with this baby? Again, they're saying he had a bowel movement inside the woman, and that could present complications to the mother. This woman, I think, should also face criminal charges. This, to me, is a hate crime. They need to go back and, besides filing suit, interview any patient that's dealt with her. Oh, go ahead and get the interviews now. Class action. They need to interview any patient that she has dealt with. And if a class accident ensues, if the hospital is shut down, I don't give a ish. You up there paying these people to unalive you with your insurance. Again, I thought about that. She knows what she's doing, I do believe. You're not going to tell, well, I had to ask these questions. That's not going to fly. That may be the little cover. But I want to make sure I got all information. No BS. So before I get upset, I'm going to end the interview in this video. Let me know what you all think. I'm out. This really pissed me off.